and welcome to this webinar about pharmacy at JCU. My name's Peter Ann Teague. I'll introduce myself further in a minute, but first of all, I'd like to commence by acknowledging the traditional owners of the land in which I meet this evening, which is the Bindala Mulgargaba people, and acknowledge the contributions of the elders past, present and emerging to our efforts to provide healthcare for communities all across Queensland and indeed Australia. So welcome. I'd like people just to go around and people can introduce themselves on the panel. Perhaps Shane McDonald, you're the first on my screen, so off you go.
Hi guys, my name is Shane McDonald. I'm a community pharmacist and I have and an ex-JCU graduate. I graduated in 2012 and I'm really excited to be here.
Just for ease, we've also got another Shane. Shane, go ahead.
Hey, so I'm Shane McCardle, third year Bachelor of Pharmacy at the moment. And yeah, just really enjoying the program.
Thank you. Renee.
Hi, my name is Renee. I am a third year pharmacy student as well. I'm also the president of jcu.edu.au, which is the JCU Pharmacy Students Association, and also very excited to be here tonight.
Thank you. Renee, why don't you keep your video on? There you go. Yeah.
Sorry,
John. Yeah, you're all right. John, over to you.
Yeah,
Introduce
thanks,
yourself.
Peter. My name is Associate Professor John Smithson. I'm the academic head and course coordinator for our Bachelor of Pharmacy program with honours in our postgraduate master's suite as well.
Thanks, John. And as I said earlier, my name's Peter Ann. I'm very recently was the Dean of Medicine, Pharmacy and Dentistry and had the great privilege of working with this fabulous team and the students in the pharmacy program. The way this is going to work tonight is very much we wanted to be an interactive sort of chatty event rather than us just talking to you. If you could please, could we have the next slide, please? Yeah, if you could just use that Q&A button at the bottom of your screen there, you go ahead, type in a question, whatever it is. Honestly, nothing is too foolish, or don't feel shy about asking something, because we're here to answer questions and to be helpful. And perhaps, John, I might hand over to you at this point just to run us through a couple of key points about the JCU Pharmacy program.
Yeah, thanks, Peter Ann. If we could have the next slide, please. Thanks. I just want to speak briefly about really the end, the destination for many of our students who go through our program. And the JCU Bachelor of Pharmacy with Honours program is a 4-year degree, which qualifies students for entry into the profession as a pharmacist once they've finished their intern year. And so the big question for you might be, what after I've graduated, and we're going to talk about our program in a couple of minutes, but after I graduate, what's the destination? And there's a diverse range of career opportunities for pharmacists in Australia and internationally. There's opportunities to practice pharmacy in community and public health environments, as well as tertiary institutions in the state healthcare system, in hospitals. We find our graduates are in the Defence Forces, leading logistics pushes in overseas. Our graduates are in industry locations. The profession itself is in a big growth phase at the moment, with lots of new opportunities coming to the forefront of professional practice. And we also play an extensive role in working with patients and other health care professionals. And I'm hoping Peter Ann's not only our previous dean, but she's a general practitioner of some significant experience. And I might ask you, Peter Ann, at some stage to maybe share your observations around working with pharmacists in practice. But before we do that, Shane McDonald, Shane's one of our alumni, and Shane graduated, Shane, what, 11 years ago, 10 years ago? You're on mute, mate.
Almost 10 years ago, 2012, I graduated.
Yeah, so Shane has had a range of experiences in the practice environment. He's also the current president of the Pharmaceutical Society of Australia Queensland branch. So Shane, can I just ask you to maybe elaborate a little bit more around the career opportunities for our graduates and pharmacists generally?
Yeah, definitely. Well, I suppose I wanted to give a shout out to those videos at the very start. There was so many inspiring pharmacists on there doing so many different things, as we saw people in antimicrobial stewardship, people working in oncology wards, people working in Aboriginal and Torres Strait health services. It's really inspiring to see that on top of our what the community generally sees our community pharmacy role, that there are all these other diverse and diverse range of jobs on offer for pharmacists. For myself, as I said, I've worked primarily in community pharmacy, and it's been a really interesting journey for me. But I've also been able to work in industry, as John mentioned. I'm the president of the Queensland branch of the Pharmaceutical Society, and what that's allowed me to do is interact with other organisations, universities, people like Queensland Health and government organisations to advocate for the community, which has been a really fun and exciting thing, part of my job. What it has shown me, though, is that we're continually on the edge of more and more opportunities happening, and more job opportunities, I should say, happening for pharmacists. Things like pharmacists working in GP practice, pharmacists being embedded into aged care, pharmacists working in this whole range of areas that really, wherever medicines are, pharmacists are working in now. And I find that that's, at the end of the day, keeping our patients safe, and being able to work as collaboratively as possible with other health professions. So I think it's a really exciting time to be a pharmacist for me, and to step into a pharmacy career if that's what you're interested in.
Thanks.
Shane, thanks for that. I wonder if I could hop in, because I might take you back a step. I mean, we live and breathe this world all the time. What do you mean by a community pharmacist?
Okay, so if I asked anyone here now, what do you think of as a pharmacist? You would potentially tell me that it's I walk down the street or go into a shopping centre and I see a pharmacist working in a shop, and that is what a community where a community pharmacist works. But that's not just what a community pharmacist does. So in the past, we've been referred to as retail pharmacists, but we do a lot more than that. There's a lot of clinical work that community pharmacists that's sort of behind the scenes that we don't quite see, and that's a lot of things like medicine reconciliation, which is making sure people are taking the right medications, making sure there's no duplication of medications or drug interactions, also with drug disease states. So we do play a significant clinical role in patients' health. The other thing I particularly really love about community pharmacy is it's something that we can go on a journey with patients with. So someone, just say horrible situation, someone goes into hospital because they've had a heart attack. They get acutely managed in that hospital. They come out into the community pharmacy. We talk to them about their medications and work with their general practitioner, whether that be a physiotherapist maybe, or occupational therapist. And we take that journey with them, and we can see them 2, 3, 4 years later and see what progress they've made in that time. And it's probably one of the best parts of my job is seeing patients make that progress back to health and be able to keep patients healthy as well.
And I think we've got a very interesting question coming up, which we'll get to in a minute. But Shane, I think what you're referring to there is continuity of care that perhaps people don't always think about, but often pharmacists, community pharmacists, are the first point of contact for people, and people often keep the same pharmacist for a couple of decades and get terribly sad, won't they, when that person retires or they have to move on because they're old and they want to retire. But there's that lovely teamwork, isn't there, and the sort of working with all the help. Okay. We'll come back to them. John, there's a question here about CANS, smaller site in terms of pharmacy. There's a question around, will this disadvantage people in any way who are coming into the program who might want to study in CANS?
Sure. So we have expanded our pharmacy program from Townsville to 2 new sites to include Cairns and Mackay. And we've developed a very specific model around delivering high quality education across those 3 sites. And so what we do is the experience in Townsville, Cairns and Mackay is exactly the same. So our students in Townsville, Cairns and Mackay all receive the same online education. They receive the same opportunities in terms of face-to-face lectorials and teaching. And the class sizes that we have in Cairns, Mackay and Townsville are replicated in the same way. So we'll have a tutor or a pharmacist leading those tutorials in all 3 sites. And so it might be me here in Townsville, but we'll have a practicing clinician or an academic pharmacist in Cairns who will be sitting down with our students and working in small groups with them. So those types of activities are not run online. They're not run across Collaborate, with exceptions of COVID, of course, when we can't come together. But we treat our Cairns, Townsville and Mackay students in exactly the same way. So here at JCU Pharmacy, we have one single mode of our pharmacy program. We replicate that same mode across the 3 sites, and all of our students enjoy all of the same support mechanisms, albeit from different people, but they enjoy exactly the same support mechanisms across all 3 sites. And we think that gives a really good level of access to what we think is a great standard of pharmacy education in North Queensland.
Thanks, John. Well, let's not take it from you. Let's hear the student voice, shall we? Perhaps Shane, shall we come to you first?
Yeah, I just wanted to say, can you hear my mic? Is that okay? Yep, cool. So just in that last part, yeah, so all the content from what I've heard is exactly the same across all campuses. That last part of the question, the practicality of the content and meeting the employees' expectations, I reckon is exceeded. I know that going on placement, the employers often can't wait to have you back. So it's definitely like the content that we are geared up with when we go on placement to these different pharmacies, I reckon.
Yeah, thanks, Shane. And we'll come back to you in a minute because I know you've had some fabulous placements recently. Renee, your thoughts about, obviously the same subjects are offered at all the different sites. Do you think the multi-site thing is an advantage or a disadvantage in your experience?
So I personally am on Townsville campus, but I do liaise with a lot of the students in Cairns and Mackay at the moment, just given my role with the Student Association. And I know a lot of them have said that they have found it quite beneficial, and everyone comes together, all 3 campuses come together for practicals. So learning how to compound and doing chemistry pracs and things like that, all on the Townsville campus. So you do still get that whole cohort coming together and working as, with all the lecturers in one area at least once a semester. So I think that people have not found that a disadvantage at all.
And John, just to clarify, that residential block is once a semester, is that right? People come in together in their cohort.
Yeah, so we can effectively teach 90 to 95% of our program on our 3 sites, but there's just some infrastructure which is too expensive to replicate on 3 locations. And so we bring all of our students together in Townsville for 1 residential week per semester across all of our years. And all of our students from Townsville, Cairns and Mackay will do those activities. So our Aseptic Techniques suite, for example, that's a very expensive facility to develop across 3 sites. And so we bring students into a central location where we've got good facilities here in Townsville to teach aseptic.
John, what is aseptic technique? Tell me.
Yeah, good. That's a good question.
I mean, I know, but
I get you. So many products need to be compounded in a sterile way. And so if we take the experience of some of our hospital pharmacy colleagues, some very, very unwell patients, say, who are taking medications for cancer, will need those medications made up in a way with a very specific dosing regimen, made up in a way that is sterile. So the hospital pharmacist will go into a sterile compounding suite. They will compound that particular medication specifically for that patient in a way that ensures that it's 100% sterile. And so what it does is reduces the risk of that patient getting nosocomial infections or hospital-based infections secondary to the product of that.
When you say compound, it's actually like a recipe, isn't it? You have a bit of this and a bit of that, and you make this fit for purpose medication for that individual patient. Is that right?
So I like to think that it's far more sophisticated than that, but the truth is that we have hundreds of different recipes, if you like, and putting it together. And kind of like a really experienced sous chef, and so we can make what we would say compound products. And the major role there for us really is when you have in a country the size of Australia, medication companies are not going to make a liquid version for someone who can't swallow, or a cream version of for somebody who needs it on their skin, which would normally be taken orally. And so pharmacists are trained in changing the formulation for the patient. So for example, if we had a tablet that we wanted to give to a 2-year-old child or an 18-month-old child, they're not going to swallow a tablet. So we might turn that into a formulation which they can swallow, such as a solution or a suspension. For some medicines that we would apply, say, via a rectal route or via a skin route or via eye drops that aren't available commercially in that formulation, we can reformulate those. And so that they're at the right dose in the right location for the patient. And what this does for us is allow us to work with our prescribers and our patients, so GPs and patients, to make sure that the right formulation is being used to get the drug in the right spot. So, for example, in the eye, without having to go through the systemic pathway, and we avoid a lot of problems associated with that. So that's what we would call
a lot of side effects are avoided. Yeah.
Correct, yeah.
I wonder if I could skip over, just changing track a wee bit. John, there's a question here about whether there's going to be any student accommodation available in Mackay next year. So obviously that's an important. The student accommodation is an important thing, isn't it? Yeah.
Yeah. So we do have facility for a small number of students in first year for student accommodation, and we do preference our first years. And so the hope there is to give people who may be moving to Mackay the opportunity to get a foothold in Mackay and understand the town before they have to go out and find their own accommodation. Now, it goes without saying, if that space isn't taken up by a first year in the following year, then we're happy for our students to stay in there as long as that situation occurs. But we do have some accommodation set aside for our first year students in Mackay. Yes.
Thank you. I wonder, should we go on to the next slide and then we can pick up the thread of conversation there? I think we've touched on quite a lot of this already, haven't we? And one of the things, John and Shane, I might ask you to comment on is really that breadth of where you can go with that degree, isn't it? I just think it's extraordinary. I mean, not only do we know that the JCU course is one of the top rated ones in Australia for having these work-ready graduates, but it seems to me it's like that Dr. Seuss book, isn't it? You know, the places you can go. And I heard you say public health, and obviously in the time of the pandemic, that's just so crucial, isn't it?
Yeah. So we're really quite proud of what our course has achieved in terms of delivering healthcare to people in regional Australia. And so about 60 to 65% of our graduates remain in regional, rural or remote Australia. And so our course was really set up more than 2 decades ago now to address the shortage of pharmacist availability in communities in regional Australia, and that's what we've done, and we take that very seriously. So we're seeing our graduates working in large numbers, working outside of very large metropolitan areas. Now, that's not to say that our graduates aren't in large metropolitan hospitals such as in Brisbane and Sydney and Melbourne. They are as well, but we're quite proud of the fact that we set this course up to improve access to good quality pharmacy care for people of regional Australia, and that's exactly what we're doing. And if I speak from my experience, I've been in a range of clinical areas in practice in community, hospital and consulting pharmacy. I've been overseas to Papua New Guinea and worked in small remote communities to deliver pharmacy care in those locations. And so I've been really lucky. And I know Shane's got a significant amount of practice experience delivering primary care and pharmaceutical services.
And Shane, obviously your career, your degree at JCU has really, you're on a track, you're head of the Queensland chapter of the PSA, which I mean, that's pretty good within 10 years of your career. So obviously how would you comment on how your course at JCU helped set you up for that sort of trajectory?
Yeah, I think for me, it's the fact that JCU, and it's widely known, is we're the best university for graduate-ready pharmacists. So I think what that does, though, is it gives you that certain amount of confidence. And if you have that confidence, you're willing to take on those extra roles and responsibilities, which then allows you to progress your career at that quicker rate. And I won't talk about myself too much in this, but I can name a couple of quick people. So we've got currently JCU graduates. We have Mr. Trent Toomey. He's the current national president of the Pharmacy Guild of Australia. He's JCU graduate. Dr. Chris Freeman. He's the national president of the Pharmaceutical Society of Australia, ex-JCU graduate. We've got, John might correct me here, Lieutenant Colonel Tamara Lee, yep, who's the most senior pharmacist in the Army, ex-JCU graduate. And so I don't think it's, for me, it's great to say, yes, I've done this, but it shows that JCU actually provides that to all of their students. And there's a significant amount of students doing a lot of things that are very, ex-students or alumni, I should say, that are doing a lot of good things in that pharmacy space.
And part of the secret, I guess, Peter, Ann, is we have a strong focus on hands-on experience. We have a strong focus on small group learning with, really well qualified clinicians as well as academics. And we have one of the highest number of clinical placement hours of any Australian pharmacy program. And so we think that relationship between the high quality learning resources that we provide for our students on the course, the hands-on experience in the practical tasks that we train and educate our students to have, sending them out on a diverse range of placements around regional Australia and sometimes overseas, depending on the context, really does increase their work-ready nature.
John, I might come to one of the students because we're having some fabulous questions come in. One of them is about placement, and the specific question is, can you do your placement in your hometown? And I think we would walk a country mile to try and enable that. But Shane, I wonder if I could start with you, and you could just run us through, and perhaps we could see the slide. Is Shane next on the slides? Let's see.
Renee.
Is Renee next? Sorry, Renee. Pam? Can we just go to the next slide? No, next. Oh, there we go. Yeah. Renee, do you want to talk us through some of your placements that you've done, please?
Yeah, sure. My placement photos are the next one if we wanted to go to that next slide. Yes,
please. Next slide, please.
Okay, so to answer the question of whether you can do placements in your hometown, you definitely can. So we get a lot of pharmacies that express interest that they'd like to have students on placement. And then basically how it works is that the placements officer gives us a whole list of those placement opportunities, and we can kind of preference them and select which pharmacies we would like to go to. Sorry, bit of an issue there. But on that note, you cannot go to a pharmacy that you have previously worked at. Just you may not experience as many things if you go to somewhere that you've previously been paid to go. The whole point is that you're there to learn. So that is one thing, but definitely if you
Renee, could I understand if I was coming cold to this degree, would I do placement every year? So every year we go on a different kind of placement?
We don't do placement every year. So first year you do an experiential placement. So basically you get to go into a community pharmacy for a couple of hours just to kind of see what it's like. You get a little workbook and you can talk to the pharmacists, talk to them about their experience, and do a couple of little activities just so that you get familiar with the pharmacy.
How did you feel when you did that as a year one student, Renee?
Well, for myself, I'd actually worked in pharmacy for about 7 years at that point in time. So I was very familiar with what a community pharmacy was like. But there were students that had never stepped foot inside a pharmacy at all. Like they'd never been sick in their life. They'd never been to a pharmacy. And they all found it a really good experience because, in first year, you do need to learn what a pharmacy looks like, what kind of roles there are. So yeah, a lot of people found that really helpful. And I think it's a good thing to do first off in your degree. I know some of the other degrees around Australia don't even walk into a pharmacy until your third year, so it would be a bit daunting.
Yeah, so that's first year you did that, and then second year you do a clinical placement.
I'm unsure of the process now, but I know in third and fourth, John may be able to speak to that one.
So in second year, we have another observational experience in hospital practice. And so we reflect the experience in first year, in second year, and students get to engage in observing practice with pharmacists in the hospital environment. And then I'll let Renee talk about third and fourth year.
So basically then in third year, you get to do, we do 6 weeks of placement in third year. It's broken up into 3 lots of 2-week blocks. And then in fourth year, you go on to do 9 weeks worth of placement. So overall, it's about 600 hours worth of placement, which is by far one of the largest amounts of placement of any pharmacy degree in Australia. And I think, as was mentioned previously, it does really help get you ready to be in the workplace. You know, a lot of pharmacists that I've talked to since being on placement have said that JCU graduates are their favourite, and they would pick JCU graduates over anyone else just because we do have that experience. So yeah, I've even gone
Renee, I see on your ISA experience, you had an extended scope of practice involving camels. Is that right? Was that?
Yes. So they do encourage us to do a lot of extracurricular activities outside of our placements. So yes, I got to see camels, and we went to gorges, and we even drove to the Northern Territory border when we were in Mount Isa. So yeah, lots of really great experiences. But I went to Mount Isa Hospital for 2 weeks, and then I went to a community pharmacy in Mount Isa for 2 weeks as well. And it was really helpful to me to learn more about rural communities, because healthcare works very differently out in somewhere like Mount Isa compared to Townsville. So I yeah, really found that beneficial, learnt a lot. We got to do outreach trips to Indigenous health clinics out in Camooweal, which was very interesting. It was completely run by just a nurse, and you know, we got to do extra training with her on different medications, got to teach her about things. But yeah, I really did enjoy my rural placement, and I think it definitely benefited me in solidifying what I've learned in the degree so far.
So Peter, and the other facet to this, and Renee's been talking about the extended clinical placement experiences as part of our therapeutic subjects from third year and moving into fourth year. We also have opportunities that during our class time, we actually go across to the hospital, and students do rotations in particular subject areas in the hospital. And so, for example, if we're doing something on myocardial infarction, the pharmacist who runs...
Sorry, John, just got to stop you there. What's a myocardial infarction?
Okay, so for those patients who have a heart attack, in their home, for example, and they're treated in a hospital, there are pharmacists who work specifically in those high acuity areas, supporting the care of those patients. And we send our students across, you know, for an hour or 2 at a time to go through rotations in those environments. And so they start at a very early stage in their therapeutics education in third year, making a direct association between the theory that we teach them in class and the actual practice environment. And Renee may be able to comment on the value of that in her experience.
Perhaps before we go to Renee, Shane, you could talk to us a little bit about your Royal Flying Pharmacist experience. I really like the next slide.
Just
with you standing by the chopper.
As a disclaimer, I did not ride that helicopter. They didn't let me.
You're just looking very, you're just standing next to it accidentally.
Just in case anyone thought I rode it, but
are you photoshopped on the boat, or are you actually on the
that's
boat?
a real boat, and that's really me. All right. I'm on there.
All right, so tell us about these particular placements.
So the first one's in Palm Island. As Renee said, well, JCU has like a really big emphasis on rural placement, so much so that they actually subsidize a lot of financial costs for going over there, which is a really big benefit when it comes to placement. So in Palm Island, I got to stay there for free and work in the hospital there, and really felt like I made a massive impact because of the gaps in healthcare that are in these rural locations. And even just as a third year student, to kind of tie into that question there, what can you expect to learn as a first year pharmacy student? You get all your basic sciences first, but as you move throughout the degree, you really start to see the real world applications. And as a third year student, I got to see, I got to apply everything I've learned so far. So that was really good in Palm Island. And the second one was Airlie Beach, which was a massive difference, mainly just tourists. And I got to be really learned on my motion sickness medication. So, which was pretty much all that went out the window, all that went out the door in the pharmacy there.
Yeah, thanks, Jen. And I wonder if we could just explore a bit further the contrast between those two placements, because they both are fascinating, but for different reasons, aren't they? I mean, obviously, working in a largely Aboriginal community, which is fairly remote, with some difficult access to care, and seeing the issues there, but also then the Airlie Beach one, where you've got lots of grey nomads, lots of people coming through, who'll turn up to you and say, oh, I need my medication, and you say, what kind? And they say the green tablet.
Yep.
So
Yep.
two very different but very important contexts.
Yeah, and there was a lot of situations in Airlie Beach where people would leave their medication at home. You would learn certain tricks of the trade, so to say, about how to supply people with medication when they're missing it, or if they can't get to a doctor at the time. In Palm Island, there were a lot of conditions specifically that mainly affected people in overcrowded housing. And so there was just a wide range. There were definitely themes, and it kind of inspires me to see what other locations might be like. It makes me really want to get out of Townsville, because when I first started placement, yes, you can do placement in your hometown, which is all well and good, but having a part-time job here in community pharmacy was good enough for me for that. And with placement, I hope to be able to get out there and see what sort of health issues lie all across Australia. And as I said, you just feel so useful, and it's really reaffirming as a student, and it sort of puts you on the right trajectory into coming out of JCU once you graduate. So
and Shane, you'll see there's a question there about working part-time in a pharmacy whilst studying. Do you think that's an advantage? Or Renee, you said you'd been in a pharmacy for 7 years before you did the degree, presumably as a pharmacy assistant. Do you think that that's beneficial? Does it get in the way of the study? Hugely. Okay.
For me, it was hugely beneficial. When I first started, I had no idea what a pharmacist was. I kind of just picked it, honestly, because I finished high school fairly well and I didn't know what to do. Once I started working, this is just my personal experience, but once I started working, I actually applied a lot of what I learned, and definitely doing placement as well reaffirmed that. And I think it is hugely beneficial. However, if you feel like it is too much to handle, always put uni first. That's my best advice. Because it's just worth it in the long run.
And Renee, I'll come to you in a sec, but John, there was a question about scholarships. Are there any scholarships available to study?
Yeah, there are some scholarships, and we have a bursary that we do in conjunction with one of our pharmacy partner groups up in Cairns through the Business Liaison Association in Cairns, and that's a small bursary for a first-year student who lives in Cairns. And other than that, there are scholarships for normal university scholarships for programs like pharmacy, and that's awarded on a competitive basis.
I'd just like to say I'm also on a scholarship. I am on a rural health pharmacy scholarship, so it's specific only to pharmacy. Mm-hmm. You can apply for that if you went to primary school in a rural community for over 5 years. It depends on where you went to primary school and things like that, but it's definitely worth looking into. That is through the Pharmacy Programs Australia, I'm pretty sure. But it funds me personally. I get around $10,000 a year for every year of my degree. And I know that there's about 4 other people in my class alone that are on that scholarship as well. Just it really helps support students that have to move away from, their rural communities to a town to study.
And also, John, I know that you're aware that the federal government, the Commonwealth government, introduced last year specific scholarships as well for one-off payments to students that have to move to study from small areas. So, and that's quite a generous scholarship. So there is funding available, isn't there? Yeah. Renee, I just wanted to finish the conversation off, and perhaps Shane McDonald, you've got a view on this as well, about the value of working in a pharmacy prior or during the degree.
I have definitely found it very valuable to work in a pharmacy. You just learn all those basic soft skills, like how to communicate with patients and, how to counsel people, how to work in a team, as well as learning all your clinical knowledge of medications, especially over-the-counter medications. Although it has been very valuable to me, I also know a lot of students that have never worked in a pharmacy, and they are also doing very well in the degree. So as much as it is beneficial, I definitely don't think it's a disadvantage if you don't work in a pharmacy, and I think your placements are enough to get you ready for a job.
Another added benefit is being able to see pharmacists up close and form personal relationships with them. There is plenty of opportunity to do that on JCU as well. But it's good to sort of actualize an end goal after the degree. And for some people, part-time work in community pharmacy would definitely help.
So Peter and
Shane, Shane McConnell, I was just going to say, are you talking about like a mentoring relationship? You see people who are in the profession and they can give you tips and tricks and inspire you to do certain things.
Yeah, and then you can sort of see how you want to do things when you graduate, and it's really good. It's better than not having that, for me anyway.
Sorry, John, go ahead.
And Peter, and from first year, we actually allocate a pharmacist mentor to all of our students. And so these are not academic mentors. These are practicing clinicians who are working in community and hospital practice. And so all of our students get a mentor. They might share a mentor, but it's the opportunity to go back to those mentors and ask those questions of them that they may not be getting from the course. You know, the lived experience of, you know, where the profession might be going. What's their view on a particular current issue, so they can connect with the profession. And what we find is two things. One is that our students become quite well connected with local pharmacists in their region, which makes their transition into practice much easier. The second is our students feel much more connected to the profession from the very early stages of the program and feel part of the pharmacy profession. And that's what we're trying to engender right from the very beginning, is our students, we consider them, trainee pharmacists right from the beginning. We set fairly high expectations for them in terms of their knowledge and their behaviour and whatnot. And the best way we can do that is to put them or engage them with good quality mentors that are demonstrating those same practices, professional practices.
Yeah, thanks, John. And in a minute, we'll come to the requirements to get in the course. But Shane McDonald, I wonder if I could come to you for a minute. And I think one of the things in the health professions is that formation professional identity, isn't it? It's so important in that journey as you go through your degree.
Yep.
How do you think in pharmacy that works within the JCU program?
So primarily, I would say through my experiences at JCU as well as a student, the JCU provides a really strong collaboration. There's also a rural, I can't think of the acronym right now. They're called RHINO. Someone might like to.
Yeah.
There
rural
we go.
Health. Yeah.
So and that provides collaboration not with just other pharmacy students, but with health students, including medicine, nursing, pharmacy, physio, and it allows people with that similar interest.
Oh, Shane, I've lost you. Can you hear Shane or not?
No.
Shane, sorry, we've lost you. That's all right. We'll come back to you in a minute. I wonder if we could go to the next slide, Pam. And John, I think this is the one where you're going to talk people through the requirements. There you go. Yeah. Yeah,
thanks, Peter Ann. So I just want to talk a little bit about our course. And so far you've heard about the role of the pharmacist and where it can take you, and heard from firsthand experience from some of our students and our alumni of how it's preparing and has prepared them for transition into the workplace. The very front end of this is, entry into the program. And so we start our first year intake in February each year. We've now got an opportunity for students to study locally in Cairns, Mackay and Townsville. And we've done that because what we're hoping to do is reduce the barriers to accessing good quality university education as well as pharmacy education. But we really do want our students to be able to study locally, do their placements locally, intern locally and work locally. And so what we're hoping is that it'll give students who otherwise wouldn't have the opportunity to travel away from home and experience a good quality pharmacy program, to do so closer to home. So our program is 4 years full-time. That includes the honours year, which is spread over the last 2 years of the course. Don't be too daunted by the idea of doing honours. The honours program is very well supported, and it's our opportunity to develop our graduates to the next level. And so they've got a good exposure to research and real life problems that they're solving over that 2 year period in conjunction with our hospital and community partners. Our entry requirements are an ATAR score of about 79. We like our students to have English, chemistry, and maths methods. But if you don't meet that ATAR score, or you're missing some of those prerequisites, such as English or maths or chemistry, we do have a number of pathways coming into our course. And if we can just move to the next slide, there's two major pathways into our pharmacy degree. And on the left-hand side of your screen here, if we have school leavers or mature age students who do meet the entry requirements, so they've got the maths, English, and chemistry, they can directly apply, and they don't need to go through a different pathway. But on the right-hand side of the diagram that you see there, we have many students who may have been out of high school for several years, or have left high school and didn't do maths methods or didn't take chemistry. And so we've got an opportunity for those students to pick those subjects up, in some cases over the intervening summer, over the November, December, January period. And we do have packaged offers where students who don't have the prerequisites but do wish to pursue a career in pharmacy are guaranteed a place in our program based on their successful completion of that particular course. So if they were deficient in maths, they can do, or chemistry, they can do a maths or chemistry program, and then have direct entry that same year into our pharmacy degree. For those of you who might need to improve your ATAR, we do have a certificate of higher education or a diploma of higher education, and that allows a pathway for those students who maybe didn't do as well at high school, or have been out of high school for a significant period of time and don't meet the prerequisites, to be able to take a foundation year. And that foundation year is really designed around preparing students to be successful in their first year of the pharmacy course. So it's got a mixture of university study skills. It has skills in English and maths. There's chemistry programs that you can take. And so really it provides the foundations that students will need in order to be successful in that transition into the first year of our pharmacy program. And what we also offer in that diploma is the opportunity to take one pharmacy subject each semester. And the aim of that is to give you a taster of pharmacy in that first semester. And as you transition into the following year, you've got a reduced study load as well. So that makes a transition from the diploma into the pharmacy program a little bit easier. And so the other major change that we've made, Peter Ann, to facilitate access is to offer the course part-time for the first 2 years. And so at any of our sites, you can do the first 2 years of our course part-time. And so then once you hit third year, though, students will go into a full-time program, and that's to facilitate the honours component of our course. And so we think that these pathways can facilitate a number of students. So either school leavers who may not have had the prereqs, or mature age students who are looking for a career change and want to move into health. And health's a great place to be. All of the data is pointing very, very strongly to an aging population. That aging population is going to be consuming more health resources, and we just don't have the population of pharmacists at the moment to be able to meet that demand that's coming in the next 10, 15, and 20 years. And so there's a very bright future for pharmacy, a very bright future for pharmacists, and there's definitely a lifetime worth of work in it for anybody who wants to.
Yeah, thanks, John. I mean, I think what's really coming through is the flexibility and the quality of it. Shane, there's some questions there, Shane McDonald, if your mic is working now. People are also asking questions about what happens on the other side. Is there an intern year? Can you start work straight away? Do you have to do some kind of rural payback or something? Let's see if your microphone works. No.
Can you hear me now?
Oh, yes.
Yep.
Yes.
Okay, good. I think the manual mute was on. Once you finish your pharmacy degree, 4-year degree, you get provisionally registered as a pharmacist. What that means is you then need to do another 12-month internship. Currently, that's through one of 3 providers. Nape is one of those, the Pharmaceutical Society of Australia is one of those, and the Pharmacy Guild is the third option. What you do during that year is...
Sorry, Shane, what's Nape?
That's a very good question. It's an acronym, but it's a internship program that is provided by some of the universities further down south. There's a group of about 4 of them together that
but essentially you have to do 12 months as a provisional pharmacist, and you can do that in a variety of settings, hospital and community. And
so 1,824 hours, so essentially a full-time year. And that is in community pharmacy, hospital pharmacy, or it could be a split between the two. So you have to do half of your hours in one particular location, but the rest can be in multiple locations as well. Apart from that, you do sit a theory exam and a oral exam to become a general registered pharmacist, and then from then on you get to work as a pharmacist, assuming you keep up your continual professional development.
Sorry, that's a little bit tough. So you've got your degree and you're all good to go, and then you have to sit another jolly exam 12 months later. Is that right?
Yeah, unfortunately, but to be fair, I actually think it really allows us to continually learn. You got to think when you're very first graduated, you do lack, you have not much experience. At JCU, we had the absolute most experience, and that still isn't even a year's worth of experience as a pharmacist. So what it does is it allows you to be mentored by a pharmacist who does have at least 2 years experience in the profession for that year, and to be able to slowly develop those skills to have the confidence to make a lot of pharmacy-based decisions yourself. So it's a very rewarding year, and it makes you, in my view, a better pharmacist because of it.
And Shane, do you have to find those positions yourself? So are Shane and Renee going to have to look at that themselves, or is there sort of a national allocation process for that?
No, so you do find those positions yourself. So for my experience, as an example, I have always wanted to do I had always wanted to do community pharmacy. So during my July holidays, we actually had placement over that time, but I went and handed out my resume to all different community pharmacies where I wanted to practice. So I got a couple of interviews, got a job there, which was fantastic. In terms of hospital placement, exactly the same. So hospitals will release time to apply for their particular positions, and once again you can apply to each hospital. Talking Queensland specific at the moment, because that's what I'm most familiar with. You can apply to each particular hospital when their jobs come out, and once again sit an interview process and that type of thing. But it's up to you to get that job, and then also it's up to you to apply to that intern training program as well.
Thank you, Renee. You've taken yourself off mute.
I just wanted to say that I've never heard of anyone that hasn't gotten an internship out of JCU. I would just like to pop that in, because it's not hard at all to find an internship up in North Queensland. And
I was going to come and say that the JCU employment rates are 100%. So pretty much you have to say no to a job to not get a job. So that's really good. Look, I'm very aware of the time. There is one question to get through, which is what options have I got if I want to go on studying afterwards? And let's run through the application process, John. Yeah. We'll answer that question. And then just to give you a heads up, I'm going to come to each of you and ask you to summarize in just a couple of words, why pharmacy? What is it about pharmacy that speaks to you? Okay.
So the application process is really straightforward. There's a one-step application process that JCU has, and it's an online application via QTAC. If you're at all concerned about whether or not you meet the entry requirements for the program, then contacting JCU directly and speaking to one of our student advisors they'll be able to fill you in on whether you meet the prerequisites or not. And even if you don't, then we've got pathways in for people who want to take that next step towards becoming a pharmacist.
Thank you. So we'll just ask these last two questions and then finish up, I think. Options for post that initial degree. What can someone with a Bachelor of Pharmacy Honours do afterwards if they want to follow a more academic course, John?
Yeah, so there's a range of postgraduate qualifications that pharmacists can do. So one that is quite common, which is not university related, but they can become qualified to be, for example, a consultant pharmacist and do home medications reviews, and they tend to work much more closely with patients in their home and general practitioners in that nexus of care. There's a range of clinically related postgraduate qualifications that pharmacists can undertake. It's quite a common qualification for pharmacists to go on and do their Master of Public Health as well, which is a very useful qualification in regional Australia for pharmacists. It's the same course that medicos would do and nurses would do, and it gives a really broad and useful foundation in provision of primary care in regional areas. And of course, there's other clinically related specialised areas, as well as the opportunity to go on to do research masters and PhD. So there's always an option for those, and a good number of our students have gone on to earn their master's degrees and PhDs, and we're quite proud of them.
Thanks, John. And so I'm going to ask each of you, and Shane, Shane McDonald, you'll see there's a question there for you about why what draws you to community pharmacy rather than hospital. I was going to just very briefly reflect on my 30 years as a clinician, the various multiple interactions with pharmacists in every sphere. The two though that really stand out for me as making just this extraordinary difference to patients' lives is in palliative care, if patients are able to end their lives in their own homes. And you cannot do that without a pharmacist who's available, who understands, who can help sort out what the medication is at a moment's notice. So that was really fabulous. And the other thing I was thinking about was the aged care sector and home medication reviews, going to someone's home, spending a couple of hours with them, going through the bags and bags of medication that they may or may not have, and really just working through that and helping rationalize their medications as much as possible. I would say as a clinician, there are many standouts, but those would be the two that really come to mind as making just such a difference to people's lives. Yeah. So Shane McArdle, why pharmacy? Tell us.
I think it's mainly just the compassion aspect. Oftentimes you are at the first point of care. People come into the pharmacy sometimes when there's something wrong and they can't see a doctor. You do feel like you form really personal connections. This is just in community pharmacy, and it's why it speaks to me. It's the only experience I have so far, and it's just that compassion is the main thing, and seeing people's health improve, and then they're really thankful, and the gratefulness is up everywhere. That's mainly the main reason for me anyway.
Yeah, and Shane, I'm mindful of, I was down south a few months ago, and I had to go and pick up something from a late night pharmacy. It was about 11:30 at night, and there was this queue of people waiting to talk to the pharmacist. I've got a rash, I've got to sort this, I've got to, this person was basically running a kind of primary care service there. It was very impressive, actually. Yeah.
Knowing a bit about everything is really good. So
yeah. Renee.
They say that pharmacists are actually one of the most trusted professions in the worldwide, actually. So for me, I think it's really nice to know that people trust your clinical knowledge and your judgment. And yeah, we are the medication experts. So quite often we're the last line between someone taking a medication that they shouldn't, that's been, missed by multiple other people. So I think that's really valuable to me. I really like that aspect.
And Renee, I think that's it's almost a hidden thing, isn't it? That pharmacists scan that environment and they can see when things are going awry, can't you? In a patient's medication or in a particular prescribing. And it's an absolutely vital role for keeping communities safe, isn't it? It really, really is. Yeah. Shane McDonald.
Yep. For me, it's being able to go on that journey with patients, as I was alluding to earlier, and being able to see them go from a state where then they're not in the best frame of mind, or they're not in the best health, and seeing them slowly progress and get out of that particular situation. Amongst that, I really like being able to educate. So whether that's talking to patients and teaching them about new tips and tricks about how to use their eye drops, or teaching them about how to use their medications appropriately and why you should take this one in the morning instead of at night, if we're talking diuretics as an example, and also being able to give back to the profession and educate young pharmacists as well in the roles of like preceptorships and in academia.
Thank you. John.
Yeah, thanks, Peter Ann. Look, for me, I think it's about being involved in someone's life journey in their health. And so we deal with people at a number of ends of the spectrum. You know, we do a lot of work in helping people maintain their health and avoiding disease. And we do a lot of work in moving people from a disease state to a healthy state, or at least a state where they're being managed. And the bit that I really most cherish is the interaction between the patient and my work as a pharmacist and other clinicians, such as the general practitioner, to bring the very best of knowledge of all of those people, including the patient, into the scenario, and being able to tailor care that's right for that individual, that they can follow and that they can benefit the most out of. And you know, being led into people's lives and the level of trust that patients have with, you know, really quite anxiety provoking conditions that they have. And being placed in that position of trust makes it all worthwhile for me.
Yeah, I think it's that privilege, isn't it, of being in the healthcare professions and people sharing with you, you know, really extraordinary stuff. And as you say, Shane, being able to be part of that journey with them and walking, you can't do it for them, but you can lighten the load, can't you? All right. Well, look, I'm aware of the time. I don't think there are any more questions. But hopefully that's been helpful to the participants. I know we're recording this, and so if other people want to watch it later, it'll be there. Thank you everyone for joining. Thank you to the panel. It's been fabulous, and good evening.